Welcome to the LATAM MedTech Leaders Podcast, a conversation with leaders who have succeeded or plan to succeed in Latin America. Please subscribe on your favorite podcasting platform: Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, etc. Today, our guest is Rolando Ganoza from Peru. He's the CEO and founder of the Alium group of companies. Rolando is a dentist, a service provider for the local dentistry sector, and a medical device distributor of innovative dental products. Rolando's academic credentials include a global executive MBA from IESE Business School in Barcelona, Spain, and a fellowship in endodontics and a degree in dental surgery. So, Rolando, it's a real pleasure to have you here today. I look forward to our conversation today. Welcome to the show.
Thank you very much. It's my pleasure. I'm looking forward
Awesome.
to talk with you.
Excellent, Rolando. Beautiful. All right, so let's talk about your involvement with the medical device business in Peru.
Well, I'm going to tell you my short story because I have a long one.
Yes.
Okay. In short, when I finished my MBA, I make a turn, a 180 degrees turn, because at the beginning I wanted to leave the health sector. Then I realized that in the health sector, in countries like mine, Peru, it's going to be an explosion of technology, innovation. It's going to be the epicenter of the earthquake. So I remake my plans. So I relaunched my dental clinic, making an investment with digital dentistry, technological, CAD/CAM for my lab, and intraoral scanner. We go completely to digital. It's something different here in Peru. 5 years ago, I'm talking about 5 years ago. So in the process, we were discovering some problems in the market. For example, with the lab, at the beginning, we make a very good percentage, but it was too big for our needs. So friends of mine start coming here asking for, hey, what I doing with this machine? Tell me, I want to make a job. Okay, and then the dental lab start making a stand alone, start working alone. And okay, that's good. But in the process, we found that there were no enough products to be milled, to be worked on. So we start importing goods. We make all the certification needed by the Peruvian country or the Peruvian government, and we start importing zirconia, PMMA, and different materials for our CAD/CAM system. So we start dealing with the government and with the permissions, licenses, and registries. That was our beginning. Then we start making our own brand. We start representing different brands from Brazil, Germany, China, Italy, in the health sector, specifically in dentistry. Now we want to expand a bit, not only for CAD/CAM. We jump on the orthodontics appliance, and also with prosthetic over implants. It's a very specific. We are working in very specific niche. Part of our business is develop the market, because sometimes the doctors, the dentists, are not aware about this technology, about these solutions. So half of our time is spending in teaching and explaining.
Educating. Yeah.
Yes. And this is going to happen for the next 10 years. We are living now in the industry 4.0, the fourth industrial revolution. In one generation, we need to change the mind of the people working on health, specifically in health sector, because this is spread around the world, and it's very difficult. The dentists and the doctors, they love the comfort zone. It's difficult to take out them for the comfort zone, but more in countries like mine, that we are very conservative in our mind. So we are looking for people who want to take the risk to jump out the comfort zone, and they will lead, because we are like this. They are leading another guys, another doctors, to jump out the comfort zone. So this is now our situation, how we ended in medical devices sector.
Okay, very good. Nice story. All right. So, what trends do you see happening in Latin America, in Peru, in terms of economic, social, disease issues? I mean, what do you see that is happening in the
Well,
region?
Latin America has been roughly hit by the pandemic. We have had very big problems in the health sector. Any national health system has been enough qualified to affront the pandemic. So in countries like Peru, for example, where 90% of the population is covered by the national health system and only 10% is by private, this 90% has been very, very, very damaged. And the national health system as well. They basically close any other treatment more than COVID. So a lot of surgeries, a lot of chronic patients were put aside. So it's very tragic. Now they are recovering. So this is an opportunity as well to improve the system, to change. They already know that the lack of beds, the lack of hospitals, has been put on the lights now. So they need to work hard in the national health systems. The unify the health system, to improve the services, to get better. One of the things where the crucial key here is digitalization, to the digital transformation, be able to get more patients with the same resources. Uh, because the resources are always limited, more than governments like ours. So we need to improve the healthcare delivery quality to those
Yes,
people.
and
All
access to the
those
healthcare system.
is made by technology. Is the only way.
Yes, yeah. Telemedicine and things of that nature,
Yes,
especially in a country like Peru, that is in the Andean region. People are far in remote
yes. The
locations,
the
right?
specialists, the doctor who are very specialized, they don't want to go to very
Of
remote
course.
province.
Yeah.
They
They
don't
are
want to
only in
live there.
Lima, and
Yes.
that's it.
Lima has a third of the population of Peru. It's a huge
Third
city
of the
and it
population.
concentrated
Yeah.
all the resources. It's not good. So if you
Yeah.
want to, the telemedicine is a huge resort. We
It's a
didn't
must.
go down. We didn't dig in Peru because uh, still we don't have this, neither the connectivity. We have a problem with the connectivity. Let's start from the beginning. We don't have
Yeah.
internet in the rural zones. So we need to
Sure.
make them come into the technology with internet at
Yeah.
least. Then we can talk about telemedicine. So the problem here is huge. But anytime I see a problem, I see an opportunity.
An opportunity. Yeah. 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 And how do you see the new government? What trends do you see with the new government with Pedro
Pedro Castillo, yes, the new government
Castillo?
is
Yeah.
very left, very lefty. It has been a surprise for us, but well, it's what we have. They have only 3 weeks, maybe 1 month
Yeah.
in
Yeah.
the government.
Yeah.
They start with the left foot as well, so we hope they they will change these things and start making good things. They were not prepared for government. They didn't have the enough people. Well, I think
Yeah.
they need to a bit understand that sometimes you want some of the requirements they have are totally agreed. We need to get out people for the poverty. Totally agree. But sometimes the way they are proposing is not good.
Yeah.
But they need, and the proposal was to get stronger the national health system, to improve the national
Yes.
health system. So
Hmm.
this is going to be the opportunity to sell medical devices, to improve
Sure.
the the
Yeah.
the um, the health, the attention to the patients. So
Sure.
yeah, I think we
And
need
and
that.
and, and to build hospitals, I guess you're
Yes,
gonna
we
start
need to
building
build.
hospitals in
Totally
rural
agree.
areas and all
The
that.
last
Yeah.
hospital built here was 5 years ago.
Mm.
It's incredible.
Yeah.
Then they get stuck with the new ones for legal problems. So they
Hmm.
need to and not all these barriers, and work with along with companies who will supply medical device and get better. This has to be attached to training programs, because most of the
Absolutely.
doctors here are not training to use high-end technology.
High-end technology. Okay. And also the other trend that I imagine is happening in Peru, Rolando, is since the middle class is growing, Peru has had a huge economic growth in the past few years, actually before the pandemic. So the middle class has been growing and adopting more Americanized, more westernized lifestyles, eating hamburgers, fast food, the chifas in the corner.
The numbers in economics, and I realized that when I was outside abroad in taking the MBA, the numbers are very good. Sometimes you look better the numbers from outside than from inside.
Exactly.
Okay.
Yeah.
Yes, we have improved a lot. We need to improve much more, and we need to insist in the same economical model for at least 20 or 30 years to get out of our situation. We need to be patient. I hope the new government will understand this and insist with some freedom, some we call this freedom of economics, because people need to work. The people need not need, they want to be free to make business, and it's very important. All the polls now this week are heading to that. People need, or they want, they ask for freedom. And the government is thinking another way. They want the government or the states take over some part of the economy and rule of them. I am a stronger believer in rules of the economy, of the free economy, like
a free economy, exactly. The free market dynamics.
Yes, totally agree.
Mm-hmm. All right. Yeah, go ahead.
But the problem here is also the health sector is overregulated. This is a problem, not only for the issues, the medicines, the equipment, also for the services. So that's the problem. In part, a problem. In part, we need to adapt as usual. So yes, the regulation is hard. The regulation is they have a lot. Sometimes it's contradictory. But with a good lawyer, or with a good equipment, we always find a way to proceed with the licenses, with the registers.
Okay, so I guess you already answered my third question that I usually ask my guests, which is, how do you see Peru as a place to do either clinical trials or to commercialize medical technologies? So do you want to expand on that? Do you know anything about clinical research in Peru? Do you know?
Even if I'm a stronger believer of the free commerce, or the freedom in the commerce, when you are in these register systems, you are protected by the barriers. So to get one sanitary register for medical equipment could take like, I don't know, 8 months, 1 year. Once you get it,
really?
Yes, it's complicated. Once you get it, you are protected, because the other guy who wants to jump in the market need to pass through this 1 year process.
Exactly.
It's not good for the client. Money. It's not good for innovation. It have a lot of problems. But for the company, for the brand who already has the sanitary register, is very good, because they are protected.
Okay.
So also we need to
know. And the name
that.
of the regulatory. Yes, and the name of the regulatory agency is DGEMIT, right?
DGEMIT, yes.
Dirección General de Insumos Médicos.
Yes, Dirección General de Medicamentos, Insumos y Drogas.
Medicamentos e insumos
the
médicos.
Problem is, the DGEMIT is overloaded by the. At the beginning, they said the pandemic. We are just focusing in COVID issues and COVID goods, but now I don't know why they still are delaying. The law says, I don't know, 45 days, and they took 8 months.
Okay, wow.
They don't have one dentist in their staff. So we need to explain. Yes, No one. So if we want to import braces for orthodontic appliance, we need to explain what's different between different prescription or brackets. So it's like
Yeah.
they are
Yeah.
good people. They are making their job very
A
carefully.
professional. Yeah.
Yes,
Yeah.
but they don't have the resources, or they will make. They I would love to see them working in a team with different
Sure.
professionals in different areas to
Exactly.
improve
Yeah.
and to be quick. They need to study from scratch. What's a bracket?
Yeah.
What is a bracket? What is,
Mm.
to understand what they are signing, because they are signing. They are giving the authorization because one the director signed this. If there's any problem, the director will get a sue. So this is not. It's not.
Sure.
It's complicated. So they are protecting
Okay.
themselves.
Okay.
When we understand how they work, we get better things. At the beginning, we were very
Okay.
confrontational with them, but no, but we need to understand what is the reality of the DGMIT. What are they doing? Why are they doing? The
Exactly.
Peruvian legislation is a copy and paste of the European legislation. It's the same. The problem is not the legislation; it's the people who read or who interpret, who explain
And implement.
to
Yeah.
implement
Exactly.
the legislation. So they are, sometimes have a different approach. They need they want more information. Um, we were working with German brands, with Brazilian. Brazil is very complicated as well, but Peru is more. And Visa, I think the name of the Brazilian authority. The guys we were working with, they already have the Anvisa number, that this registration, but here they said it's no way they are asking you for this. This is like this. So we talk with them. We have the ability to talk with the guys here and ask them before sending the file, what do you want? How do you want? So we make it better for them. We uh, rise more information. We put it like they want to. We spread the families because we're trying to make families with the registrations as they want. So to make it easier, we don't want to spend 3 months and get a letter from them asking for more information. This is terrible because it it sends us to the square one. We don't want it. So we try to make better at the beginning, to talk with them, asking, what do you want? How do you want it? And giving them, even if we want to fight with the provider, because at the end we make some tension with the provider because we are asking for some as amount of information that they say, what are you asking for me? Are you want to copy me? No, I don't want to go. I can't copy you. I just want to send information to the Peruvian authorities. It's a process. We need to understand. We need to live with this, and we have the resources for that.
Okay. Are there any initiatives to improve the HIMIT's work
Yes,
by
they
the
are
new
talking. They
government?
are talking about to make a
Okay.
change because the pandemic also discovered this. We have some problems with the vaccines.
Yeah.
So yes, they have talked to change it, but nobody
Okay.
knows how, know when. This is the problem. So sometimes the medicine is worse than the sickness. So I hope
Yeah.
I hope they will make better. It's very easy, but we don't know.
Okay. Okay. So let's talk about the approval process, the pathway. We already discussed that it will take about a year, 8 to 12 months. And does it matter what type of device it is? A low risk, a high risk device, regardless of
Basically,
the
we are working with,
classification?
with class 2 and class 3. Class
Okay.
1, they don't need it. It doesn't need any registration.
Really? Oh, that's
Yes,
great.
class 1 no. Class 2 and 3 yes. Uh, for
Class two and
example,
three, yes. Okay.
the GEMIT has a list. They sometimes work in the other way. They have a list of goods who doesn't need registration. This list is actualized every 6 months, every 3 months. So we are always looking at that list, see if we have any opportunity there. But the other things, class 2 and class 3, we of course class 2 is easier, class 3 is a bit difficult, but it's no problem.
It's
no problem.
Okay, is it a reference country that they need to see, like the United States approval, FDA, CE mark from Europe?
It's better when they have FDA and CE, but no, if not necessary, it's not mandatory.
It's not needed. Oh, okay. So you can have home country approval. Let's say I have a product from China and they don't have FDA or CE mark. I can get it in the market. Very good.
Yeah,
very good.
Actually, we have like country, we have a treatment of free agreement with Europe, with China, with United States. So there is
free trade agreement
called ad valorem. In Peru, could be from 6% to 11 or 12%. With this agreement, we
tax import duties.
Yes, we don't pay that duty. So 66% less in taxes at the moment of the importation. At the moment we're going to import the goods. And also,
could you repeat that?
When with countries with no trade free agreement, we have to pay 6% of the ad valorem. It means
got it.
In the CIF value, we have to pay 6%.
Yes.
At the moment we get the
6%.
Yes. Here in customs, we need to take out of customs. We need to pay the VAT, the VAT tax, and the ad valorem. If we can demonstrate with an origin certificate that these goods come from a country, it's a tricky thing because it's not only a country, it's the city in the country which we have a agreement. Yes, because we have a problem with a Chinese provider. They send us the good from Hong Kong, and they are in Shenzhen, and the certificate was in Shenzhen. And he say, no, but this is Hong Kong. But come on, it's China. No, it's a different city. So they are always trying to hit you with the tax. But we learn.
I see. Okay. Yeah. You learn. So, do you use a regulatory affairs consultant, or you do these?
No. We need
yourself in your company.
We use a consultant.
Consultant.
We use a consultant for the regulatory issues. We need a consultant for a lawyer for law. We have a consultant for import customs as well. No, we love to work with guys who are very very skilled in the sector.
Yeah.
It's impossible to cover
professional.
We have made a team. It was not easy. For customs, we are maybe in the 4th company working with. We didn't match good, or we didn't have the feedback, or we didn't have the service we asked for at the beginning. So we changed. We, like Steve Jobs said, fail often, fail quickly.
Well said. Yes.
Yes, we try. It doesn't work. Okay, next. And so on, because it's a problem. And it's the same with the regulatory issues. We get a company with a couple of guys, very young, very, 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 very clever, with contacts. They love to work. They handle these things very good. So we are now really very happy with the team we have built with them.
Very good. So let's talk about the market in Peru. How big is the market? How big is the population? How percentage of the population is covered by insurance? How is the reimbursement in the system? Can you talk about that, please?
We are more than 30 million people. Most of them in the Peruvian coastal. We have like 2,000, more than maybe 3,000 kilometers of coast in the Pacific Ocean. The country is more than 1 million square kilometers. It's a big one. And it's very hard. The geography is very complicated. We have like a dorsal spine going to from north to south.
The
Andes, yes. The people is living there, and separate the country to the desert coast and the Amazonian rainforest. with rivers. In the Amazonian, it's impossible to think about the highway, for example. They use rivers for the highways. Yes, and also we have a lot of national reservation for forest and animals and all this stuff.
National parks and all that.
Yes,
Yeah.
and the like I said before, 90% of the population is covered by the national health system. It's a problem because it's not integrated. Actually, we have 3 or 4 entities in the national health system: the government or the state own health system. A salud is some type of insurance for workers. It's standalone. They have their own hospital, their own doctors, their own systems. It's paid half by the workers, half by the companies. And the military and navy, police, they have their own systems. And the in more than 15 years ago, we start making we call the decentralization process. So the government received for years a lot of critics because they lead they manage everything from Lima. So they start with the political division of Peru are regions. We have a lot of regions in Peru, maybe 12, and they start giving autonomy to the regions, basically in the budget. And part of this budget was the health system. They start uh, managing the budget in the health sector in each region. The problem was they have the money, but they don't have the skills. So they start to degrade the health system. Now they are talking about reintegrate in one piece all the national health system. So this is the status actually, no? So there are regions very good, there are regions very, very bad working with this. In the private sector, we have 10%. It's the high end, the uptown class. We have 4 or 5 insurance company. There was a gap here in the law because the law allow them to integrate vertically all the. Yes, it's not good because the insurance company start buying medical clinics. So they not only they provide the service and they pay for the service. This is not good because they adjust the tariffs so hard because they don't care if they lose money in the clinics. They will earn money in the in the company, in the insurance company. But what happened with the clinics with no rooftop like an insurance? They
Okay, damages the market. It's a price down competition.
Yes,
Yeah.
yes. So the
Wow.
reimburses working here. Okay, they have different tiers of clinic. No, tier one, maybe their own clinic. Maybe you don't pay anything, or you pay just 5 or 10% of the bill. Another type of clinic, you pay maybe 50% with higher tariffs because they negotiated.
Yeah.
And the out of pocket in Peru is very high for
It's very
all,
high.
not only
Okay.
in private, only in the national health system. Because what
Also in
happened?
the public.
Yes, for
Yeah.
example, my father was a Navy officer, so my mother is in the Navy system in the. So I
Military
went.
regime. Yeah.
Yes, I went to the Navy hospital to get their medicament because she is 85 and she's had some chronic disease. She's very fine, but she had some chronic disease. So I went for
Sure.
and sometimes they don't have this pill. No, we don't have it. We don't have it. Okay, I don't have problem to. I'm gonna buy the medicine for my mother, but what happened with the guy who doesn't have the resources?
Exactly.
That's a
Yeah.
problem. Theoretically, yes, they are. She is covered, but in the practice, not so much.
Okay, I see. But is healthcare a constitutional right in Peru?
Yes, yes,
Okay, so
yes.
everybody has access to the system regardless. I mean, in paper,
Health
at
and
least.
education, yes,
Okay,
but the problem is
okay.
the quality. O
It's
sea,
equality. Yeah.
we are not going to talk about the quality, but because we have problems in the quality in the private and the public sector, but
Okay.
the coverage is not good. Let's start from the beginning.
Okay.
Let's start for the coverage. It's not good. It's not 100%. And
Mm.
the other side, the quality is It's complicated.
Okay. What about reimbursement? What if I bring a new medical device and I want to get in a code in the system so I can get reimbursed by the system? And there are actually 4 different systems or something like that. So you have to get reimbursement in each one of them, or what?
Some of them do not allow to make any reimbursement. Specifically the public sector. Actually, we have a huge problem now with the COVID because the national health system ran out of beds for intensive care beds.
ICU beds.
Yes,
ICU beds.
ICU beds. So they went for the private. They
Okay.
also collapsed, but by the people that said no, it's not possible. The
Wow.
private sector. The government say I'm gonna pay
Yeah.
for
Gonna rent
the
beds
guys.
in
I'm
the
gonna
private
send
sector.
guys to the private. Well, they send some. I don't know, maybe 100. They didn't pay anything, but they still have process. Yes.
Wow.
One thing is when they say it, and the other thing is they do.
Yeah.
So it's maybe it's not a problem of the good intentions. Sometimes they have good intentions. The problem is the system is so complicated that now we need to reimburse to the clinics with 100, or maybe you have 5, you have 10. Okay, the process is very complicated. You have to
Okay.
demonstrate to the government or to the national health system, you made this design. They start looking for any error in the medical history. No, you didn't do that. Your
Sure.
file
Yeah.
is a problem.
Yeah. But in your case, you are in the private sector. You sell cash, right, to other dentists and all
Yes.
that, and their patients pay cash. So it's a
Yes.
cash system
Yes.
where you are.
Yes. Actually, one of the things we made from the beginning is our products will we sell in cash. Why? Because we're trying to lower as much as possible the prices. Have people in charge to call you for the bill. It's gonna cost me. Okay, I don't want that cost. If you want that,
Sure.
you want credit. Okay, you have to pay for that. You have to pay for the
Yeah.
system who is gonna
Exactly.
call you
Yeah.
to pay the bill. If you are making numbers and you see, okay, this gonna cost me this amount of this, okay, I want to be very efficient. I want to have the best
Sure.
price in the market with the best product. I have to take out all these overcosts,
Sure.
overheads.
Overhead. Yeah.
But because we
Yeah.
are working in a niche. But if we need a huge machine, a milling machine, for example, we're talking about maybe $500 here, $500 here. We are talking with the bank to make a lease, for example, because we don't want to. We are not expert. We don't have expertise with credits. So I
Sure.
prefer to go to the bank and pay the bank
Exactly.
what they
Yeah.
are going to ask me and make a lease with them.
Mm-hmm. They're expert at that.
Yes.
Yeah.
Yes.
All right, Rolando, we're close to the end of the show. And usually the last question I usually ask my guests is your words of wisdom. If you had the CEO of a medical device company from the United States or Europe that is just looking at Peru as a place to do business, as a place to commercialize his or her medical technology, what would be your best advice to him or her?
Well, first you have to find a partner, a reliable partner here. We have been talking about the spaghetti, all this national health system and regulations, and it is the Peru. But we have also the sauce, the pesto or olio and oglio, is the corruption. So all this is involving corruption. So, for example, we as company, we want to be as far as possible from the corruption. We want to work fair. It's important not only for my company, because I don't want to destroy my company. I don't want to destroy also the brand I am representing. So this is important for any company coming to Peru to be very very acute, very clever. And say, I don't want corruption. I want to play fair. I want to go, even if it's the longest way. I want to go through all this process by law. So this is my best recommendation. Find a good partner, get know him, and go with them. Sometimes
And
we need
follow the
support.
law.
Yes, we need.
Yeah.
Yes, by the book. You if it's intricated, it's complicated, but it's not impossible.
It's not
Uh,
impossible. It's worth it because it's a
yes,
huge market, 30 million
yes,
people. Yeah.
yes, and
Hmm.
we need to develop this a lot. So we are working in dentistry, in digital dentistry, not to fight our competitors. We are working to increase the pie, to increase the market.
Yeah. Well
Outside are
said.
more people than inside, actually. So this is an
Yeah.
opportunity for all
Well said.
devices in medical as well.
Excellent. Excellent, Rolando. I really loved our conversation. And how can people get in contact with you? Email, LinkedIn?
Yes, I'm in LinkedIn, I am in Facebook, I am in Instagram. My name is Rolando Ganoza. I will share with you my contacts, but whenever you need, I'm open to discuss, to talk, to give you my advice.
Excellent, Rolando. Thank you. Thank you. The
Thank
industry
you.
needs more people like you.
Oh, thank you very much.
Because the whole idea of my show is to show Latin America as a land of opportunity. And one of the problems here in the region, in Latin America, including Peru, is that patients have not access to innovative medical technologies. So interviews like these with people, with experts like you, help or in contribute in one way or another to have patients better access to medical innovation and to make companies in the US or Europe aware of the opportunity that Peru represents.
Thank you very much.
Yeah,
I really
that's my
enjoyed the
mission.
interview.
All right. Thank you so much, Rolando. Have a great day.
Bye bye.